Good afternoon, everyone. Thank you for joining us. Welcome back, and we're glad you're here. I'm Steve,
And I'm Scott.
and together we are Backyard Musing Science and Technology Channel.
Yeah, and we are talking this afternoon about a study, which I'm not quite sure I'm in on this, but
I'm not either. So you can probably guess this is about Alaska. That's the only state that gives everybody money every year.
yeah,
So let's launch into this. A major new study challenges the idea that giving people cash leads to chaos. Okay, well, we're talking about Alaska, and it's pretty targeted. And I think they give that money to entice people to come up there because who wants to live in 24-hour sun for 2 months and 24-hour darkness for 2 months, you know?
yeah, and it's very expensive to live up there, from what I understand.
Yeah,
Yeah,
yeah. Not to mention the harsh weather conditions, too.
right.
Okay, programs that provide money directly to individuals are becoming more common across the United States. Despite their growth, these cash transfer initiatives remain controversial, with critics questioning whether they are effective or even safe. Some opponents argue that recipients may quickly spend the money on alcohol or drugs, potentially increasing the risk of injury or death. Uh, Personally, I think that not necessarily drugs or alcohol, but they're going to spend it on something and then depend on it to come again and again and again. You know, get dependent on that government dole, which
Welfare
that's bad.
mentality.
That's worse than drugs.
Yeah, welfare mentality.
Yeah.
And
Would you like to know more?
yeah, and it creates a culture, right?
Yeah.
My mom was on it, I'm on it, and you're going to be on it as my kid. You know, that's just kind of the. I mean, I'm not saying that all the time, but generally speaking, it creates a culture. A new study that followed a major cash transfer program in Alaska for 11 years challenges those concerns. The research found no evidence that direct cash payments raise the risk of traumatic injury or death. The study was conducted by researchers from the New York University, the University of California, San Francisco School of Medicine, and Alaska's former chief medical officer. Their findings were published in the American Journal of Epidemiology on January 29th, 2026 this year. So,
And we should point out that this Alaska fund comes from Big Oil.
correct.
Big Oil set up a trust fund, huge one, in order to get permission or whatever to drill in Alaska. And this fund, you know, it collects interest. There's payouts, but it's like it's an annual payout, like 1,000 or 2,000, whatever. It's not 1,000 per month.
Right.
You know what I
Well,
mean?
even so, I mean, let's just say that you're living up there, and between this and maybe Social Security or another kind of pension, that's the only income you have. And this dries up. That could affect somebody's living pretty extremely, right?
Yeah.
Because you depend on it. It becomes a regular thing. It's like relying on your tax return every year to have a vacation or buy some new furniture or whatever. And my whole thought, and I'm not trying to get off on a tangent, but my whole thought is that I'd rather keep my money during the year, and then if I have to pay a little bit or get a little bit back from the government, because that way I'm not dependent on that big chunk of tax return to come in and subsidize my lifestyle. And that's what this is. It's a subsidy, right? It's like you said, it's you're on the dole. Kind of like what they've been talking about lately and a few states have passed reparations, and they're talking about in California. You know, I mean, that's just.
And where's this money coming from? Is it taxpayer money? I don't want my tax dollars, because California taxes us, man.
They do.
I don't want that to go towards someone on the dole. And these stipends in Alaska, it's the same amount for everyone. Anybody who lives up there gets the same amount. But like these cash payments, like in Stockton, for example, they were paying like $500 a month to low-income families, right? I mean, yeah, I suppose it could help out families, but when you get on the dole, it's that mentality like you were talking about, Scott.
Stockton, one of the first cities in California to go bankrupt. Just put that out there. So, anyway.
Okay, quote, past research has shown that cash transfers are an effective tool for reducing poverty, but their implementation is often limited by critics who worry about irresponsible spending that can lead to tragedy, says NYU sociologist Sarah Cowan, founder and executive director of the university's cash transfer lab. Oh my gosh, which conducted the study. Quote, those fears are unfounded. Our long-term study of a state's population shows no connection between cash transfers and serious injury or death. Come on. I mean, Alaska, way different than subsidies given to poor people based on the amount of money you earn. Way different.
Yeah.
In so many levels.
Yeah, you can obviously tell from our tone that we're not pro on this at all. So the research focused on Alaska's Permanent Fund Dividend, or PFD, a long-running program that provides annual payments to residents. Quote, as a practicing emergency physician, I worried about yearly PFD leading to immediate harm, but as Alaska's chief medical officer and public health official, I know how important it is to review the data objectively. That's according to Ann Zink, chief medical officer of the state of Alaska from 2019 to just a couple of years ago, 2024, and now a senior fellow at the Yale School of Public Health.
Quote, this study provides the kind of population level evidence that public health officials and policymakers need when evaluating guaranteed income programs. When looking across the entire state's population over 11 years, there was no evidence of increased trauma or mortality temporarily associated with the PFD cash transfer.
Previous studies on cash transfers have produced mixed results. Some found no link to injury or death, while others suggested a possible connection. According to the authors, this research stands out because it covers all traumatic injuries and deaths statewide and spans a much longer time period than earlier studies. It also evaluates a universal program affecting an entire state, capturing a broader and more diverse population than most guaranteed income research. I mean, we know that there's not a lot of people in Alaska.
Right.
And like you said, there's no stipulation on your income. So if I'm making Social Security or a disability pension, I get the same amount that some guy that's an oil baron is getting. Now, maybe they're not accepting it, right? Can they turn it back? Like you can, if you don't want your tax return, you can give it back to the government if you're that crazy. But I wonder if these people can not just say, no, I don't want it. But it's,
well, $500 a month, that's $6,000 a year. That's a lot different than $1,000 or $2,000 that Alaska gives out. And again, right. I'm pretty sure that this fund is to entice people to come and stay in Alaska. You know what I mean?
That was probably the original initiative of this thing, right? Or information was, we'll pay you to come, and so. And
it's not much, $1,000 to $2,000. I mean, yeah, you could buy a new refrigerator, you could buy a new stove, you buy some food, but I mean, Alaska, you can go out and shoot a moose and you'll have food in your freezer for 4 months,
Yeah. Or, I mean, if you're smart about it, you could take that money and invest it. And, it might, depending on what you invested in, it could grow. So that would be the good thing. But probably most of the people are not. They're subsidizing their income with that.
Right. Yeah. Okay. Additional contributors to the study include Ruby Steedle, not making that name up, a researcher at the Cash Transfer Lab, and the paper's lead author, and Taske Bongiovanni, an associate professor of surgery at UCSF School of Medicine.
Why'd they come up with a name like that? Cash Transfer Lab. That's interesting. Since 1982, Alaska has distributed an annual payment to every resident. The size of the payment changes each year, but usually falls between $1,000 and $2,000 per person. So that's, again, if you invest that money, that's
and if you've got 5 kids and 2 parents, that's 7 times 2,000, 14,000. Yeah, that can make an impact.
Exactly. But this long-standing program provides researchers with a rare opportunity to observe how a universal basic income style payment, along with other cash transfer programs, operates in real-world conditions. I don't know about real world. I mean, Alaska,
I would think
not a real world, is it? I mean, it's different.
Yeah, I would think that if you get people who want to give money to a fund in order to dole it out to people. Maybe that's not the right word, but to disseminate it to people. Yeah, I guess that's altruistic. Watch it carefully to see what happens.
Like a
And,
charity.
how did
Like a
Stockton
charity.
do?
Like a
Yeah,
charity,
like
right?
a charity. How did Stockton do? I think it went bankrupt before they started the payments.
I think they did. Yeah.
Yeah.
But again, you'd think that they would have learned their lesson that you just can't do this. Can't give out free money. So is it me?
Yep.
Where am I at here for this study?
Yep.
For this study, the researchers analyzed data from 2009 to 2019. They reviewed all traumatic injuries treated in Alaska hospitals using the state's trauma registry, along with all reported deaths recorded in vital statistics.
And again, I don't know why this is important.
Why are they fixated on death and injury?
I don't know. I mean,
Are we talking about suicide?
$1,000, you're not going to be able to drink yourself to death. Maybe overdose, yeah, but
Yeah, I
I don't know. All right. The results showed that Alaska's annual cash payments did not lead to an increase in serious injuries or deaths from unnatural causes in the short term. This conclusion remained consistent across multiple robustness checks. Injury and death rates did not rise in the weeks immediately following payments, which are usually distributed in the fall.
Importantly, the same pattern was seen in Alaska's urban areas, which resemble small and mid-sized cities in the continental United States. This suggests the findings may apply beyond Alaska. Quote, together, these findings provide strong evidence that narratives about short-term harm from cash payments are unfounded, the authors concluded. So,
again, how did Stockton do? There's other cities that have done this. How did they do? How did the people there do it? Let's look and see.
Yeah. And I don't know. Again, interesting topic. But yeah, giving people stuff for free usually does not turn out well. No,
I think remember back when you were a young couple with a baby or two, having to put food on the table, selling your blood or plasma occasionally. This probably would have helped, right? Altruistically. You and I are hard workers, so I don't think we would have went down the path of what else can I get from the government. It would have been a nice little help, a bump to get us going, put bread on the table rather than giving blood.
Yeah, but again, year after year, it creates a culture and not a good.
Once you climb out, I'm being the devil's advocate here. Once you climb out of that poverty, you get an education or whatever at a trade school or university, and you enter the workforce, then you say goodbye to that. It helped me out. Thanks a lot. I'm on my way, I'm being fiscally responsible. I'm paying my tithing. I'm obeying the commandments, so I'm going to prosper.
Right. But like you said earlier about setting up possibly like a charity, that's a way where people could give back to that, right? They could donate to that instead of it coming out, because it's coming out of somebody's pocket. It's not free money.
Right.
I don't know if the lower 48 are paying for this, or
it better not come out of taxpayer money. No way.
It's subsidized by big oil or the oil companies up there, which I get that. But what does that do? Is that driving up the price of oil or price at case? Again, looking at this as a simple guy, I'm not worried about the price of oil. I'm worried about the price of the pump. I don't pump oil into my car. I pump an oil-based product, but I'm pumping fuel. And if it fluctuates, then you think about, are you subsidizing this program just to entice people to go up and it's a beautiful state, but it's just kind of harsh conditions in some places. So, but anyway.
All right, folks, thanks for joining us. Leave your comments. Let us know what you think.
Yeah, if you know anybody that's involved in this or you're involved in it and you got some experience with this, let us know how it works out. So take care, everyone.
See you.
See you tomorrow. Thanks.